Hi there, my name is Tanae Valiva, and today I'll be giving a brief introduction to our organization at Alaska Behavioral Health. Just some background information on me. I'm a master's level clinician working towards licensure. I graduated from the Master's in Clinical Psychology program at UA in May of 2023 and officially became an employee at AKBH in June of that year. So I did my clinical internship in our child and family continuum, spent 2 semesters interning here before officially joining the team after graduation. Our organization is all about partnering with the community and providing easy access to services, which is why we wanted to produce a short video on our child and family continuum specifically, and hopefully answer any questions that you might have about our organization. Okay, so our organization is actually celebrating our 50th anniversary this year. We originally went by the name Anchorage Community Mental Health Services, or ACMHS. You might still hear that every once in a while, but as of 2020, we go by Alaska Behavioral Health. We have several locations throughout Anchorage and Fairbanks. The Alaska Child Trauma Center was established in 2005. And then since then, we've really just continued to expand our services and locations. And we recently opened up a clinic in the Valley, so we are now seeing clients out in Wasilla as well. We are a certified community behavioral health care center, so we provide a wide range of services, which we'll get into in a minute. But we do ensure quick access to care, meaning we don't have a wait list and we can offer same-day appointments. The main services we provide are individual, group, and family therapy, both family therapy with and without the client present. So you'll see that a lot in our child and family continuum, or we sometimes will just meet with parents to support them in learning skills. And then we offer psychiatry, primary care, skill development, which we typically call our TBHS or therapeutic behavioral health services. So in our clinic, this is where clinical associates, so like bachelor level providers, can go into the community with clients and work on skill building, and then case management and outreach as well. Just a little information about our client population. Over a quarter of our clients seen are under the age of 18. About 1/5 of our population is made up of transition age youth, so individuals from about 16 years old to 24. And then we tend to see slightly more female clients than male clients. The majority of clients seen in our organization are adults, but we still serve a large population of child clients, with it being pretty consistent kind of across that 5 to 17 age range. About 2/3 of our client population is white and about 1/3 are persons of color. And in my experience so far, I've had a really diverse caseload with clients from all many different ethnicities, cultures, religious orientations, and other demographics. So I do really enjoy that about our organization. And then again, these are all of our different outpatient services we offer. So assessment, individual, group and family therapy, peer support, psychiatry and primary care, case management, wraparound supports, and then school-based services. In our organization, we provide measurement-based care using evidence-based practices. So here are some of our child and family EBPs. ARC is kind of our main one. This is kind of our foundational model here in the outpatient clinic. ARC stands for attachment, regulation, and competency. So we offer individual, family, and group therapy using ARC components. Child parent psychotherapy, which is for really young kiddos like 0 to 6. PCIT, or parent child interaction therapy, where we do live coaching with parents, as well as PC cares, which isn't on here. PC cares typically serves about 1 to 10 years old, which is similar to PCIT, but a shorter treatment length, and PCIT usually serves about 2 to 7 years old. And then a new evidence-based practice that about half of our child and family providers recently got trained in is MATCH ADTC, which stands for Modular Approach to Therapy for Children with Anxiety, Depression, Trauma, or Conduct. So pretty much it's like a very structured CBT. We're currently a part of a learning collaborative with the Baker Center out in Boston. I'm actually a part of this team, and we've had other learning sessions throughout the year in Seattle. We'll be going to Chicago this summer. But we are currently already offering MATCH to clients now, and I personally have found it very beneficial for both clients and also just as like a new provider who recently finished school and was looking to get more formal training in an evidence-based practice. We also offer TFCBT for children and adolescents, and then going into our adult population, CPT, DBT, CBT, some motivational interviewing, and a little bit of EMDR. This slide just speaks to our outcomes, specifically clients who have experienced trauma using the PCL5 to measure care. You can see that we tend to have pretty significant symptom reduction. And then a little bit more about our continuum. So we have our Little Tykes therapeutic preschool program for children aged typically 3 to 5, but you may see, a 2 or 6-year-old here or there if it's deemed appropriate. But this is for more like intensive skill building to help kids improve their social emotional skills. And then family therapy is tied into this as well to support parents. We then offer school-based and wraparound services. We currently have a clinician at Chester Valley and Willowa Elementary, and then Clark Middle School in Anchorage. And then we also are at several schools in Fairbanks. So it's really nice that we can provide that in-school support. And then our PHP, or partial hospitalization program, or day program for youth ages about 9 to 17. So we typically have 2 groups that run for this, for like the older and then younger halves of those age ranges. This is a more intensive treatment for significant persistent mental health challenges, including suicidal ideation. So it's typically about a 2 to 3 week program, and then clients will step down into outpatient. And we are actually hoping to implement an IOP program to offer kind of another level of care between outpatient and PHP. We have our Power Center, which is a drop-in center for transition age youth, where they can receive free access to hygiene products, appliances, showers, food, and more. We also sometimes run groups here. And then our Seeds of Change location, located right next to Power, which offers paid apprenticeships and school credit for youth aged about 14 to 24. And I was actually able to do part of my internship here, and it's just a really warm, supportive environment. The hydroponic greenhouse is super cool. We also run groups and other community events here as well sometimes. And then kind of just moving out from our child and family clinic to the organization as a whole, we have our Cohen Clinic, which offers short-term evidence-based therapy for vets, active duty military, and military families. We have a Cohen Clinic in both Anchorage and Fairbanks. And I know someone from my cohort at UAA had interned there, and I believe they had a really good experience. Our adult outpatient clinic, which right now is off of Lake Otis Parkway in Anchorage, our child and family clinic in Anchorage, and the adult clinic recently swapped buildings. So child and family was on Parkway, adult was on Folker, and then in October this past year we had swapped. And then we have our adult outpatient clinic in Fairbanks as well. So similar to our child and family services, we offer regular therapy, medication management, case management, and peer support. Okay, and then we have our mobile crisis team in Fairbanks. I'll let you kind of read off of there. This one is a service that not a lot of people know that we have, but I think it's really awesome that we can provide this up in Fairbanks. And then our PHP program for adults located in Anchorage, which offers stabilization for adult clients with mood disorders. And it's nice that adult clients can avoid hospitalization if they have a safe place to stay by engaging in PHP. Similar to our child PHP, we use DBT and CBT skills for our group formats. Adults have 2 psychiatric appointments weekly, and then treatment also includes like a lot of snacks, things like that, which is kind of a joke. But we're really big on snacks at all of our clinics, not just PHP. We want our clients to feel comfortable, to be able to make good progress in treatment, and it's hard to do that on an empty stomach. So we typically keep snacks and drinks readily available for our clients. Okay, and then lastly, we do offer adult residential services. We have a treatment facility in Fairbanks, and then we have partnered up with other community agencies for our 2 residential adult programs in Anchorage. And then our next few slides are just how to get in contact with us, all of our different locations. So we have our Anchorage locations, Fairbanks, Contact information. We do bill Medicare, Medicaid, and private insurance and have a sliding scale fee for those without insurance, so that is nice. Just some crisis resources. And that is it. I included my email here at the end. If you do have any questions, you can always reach out. Feel free to email me. I may not have the answer to everything, but I can definitely point you in the right direction. So, yeah, we appreciate you tuning in. Thank you.